Now, here's Michael Smerconish.
Imagine needing a new heart in the midst of a pandemic. That is precisely the situation in which my next guest found himself when admitted to Johns Hopkins Hospital in February of 2020. You must read the essay that was written by Kirk Dorn, published right now at Smerconish.com and consequently in today's newsletter. I have known Kirk a long time. Kirk, we, I guess, first crossed paths back at WWDB. Were you there after me? Help me remember.
I also was trying to remember that, Michael, because I was the news director there in maybe 97, 98, that era. And you were, I think, in the midst of crossing town at that point. So we might have overlapped at that station.
You were there when there was a format change, I think, right?
Correct.
Was that your era?
Yes, we brought in News Talk to WWDB FM, and that was, we had the morning block, the 4-hour morning block, and I think you were still there at that point. You had only transitioned from your legal career to your radio career not long before that. I can't recall when you actually started, but you were doing some part-time before you exploded into your all the other work you've been doing.
I'm still waiting to explode. So how about this? Suffice it to say, we have known one another a long time, and in a variety of contexts. Kirk Dorn is a senior vice president at Seisler Media and Issue, which is a Philadelphia-based full-service public relations and issue advocacy firm. It's a pure coincidence, but earlier I chatted with Larry Seisler on this very program. You're here on an entirely different matter. And one other thing I want to say at the outset, because we're recording this via Zoom for YouTube purposes, you look great. How do you feel?
Well, thank you, Michael. I'm completely normal. I mean, I feel fantastic. In fact, I feel better than I have felt in 20 years because I had that genetically defective heart for all those years. I was fooling people. People didn't know that I was sick. But now with the new heart, I'm climbing mountains. I'm feeling much better.
Kirk, how old are you?
I have just turned 67.
And what was the nature of the genetic deformity in your original heart? It
was the disease is called ARVD, which is letters for a very long name. But basically, the heart was twice the size. The right side of the heart was twice the size that it should have been. As a result, it couldn't pump the blood properly. And it finally got to a point where it just couldn't pump it at all. So the left side is the pumping side, but the right side then couldn't send the blood into the bloodstream. And that's how the circulation works. And I actually didn't know I was as sick as I was. Went to the hospital to get what I thought was a tune-up to keep me going. And the next thing you know, a month into the hospital, I'm on life support, and I was very lucky. They found a heart for me and got the transplant.
Was this the time period that I referenced, February of 2020, 1 month before we all became aware of the pandemic?
It was the amazing thing. I couldn't have been in a safer place. I mean, I was in the hospital from February to June, and all the world is going crazy with the pandemic, and I'm there in my room trying to recuperate. Well, first getting the transplant, and then trying to recuperate for all that time. So yes, that's exactly, it mirrored the pandemic.
But if I had spoken to you in January of 2020, you would have had no idea that you were soon to undergo a heart transplant.
That is correct. Typically, you stay on the list for a year or a long time. You wait because there aren't enough hearts or organs in general for people who need them. Many people die waiting for these procedures. And but I had no idea I needed one at that point.
And if this is uncomfortable to discuss, by all means, I'll move on because it's not the focus of why you're here. But I'm just curious, what do you know of the donor?
Michael, I have written letter. They have a system. It's an anonymous system where you write a letter to an agency. They reach out to the donor family, and the donor family has not chosen to respond to my letters. I mean, I'm so grateful to them and want them to know that, but they have not responded. So the only thing I know about the donor himself was that he was in his late 20s, but I'd have no idea what the circumstances were, how he died, et cetera. But very grateful to his family, although I have not been able to contact them.
So, Kirk, what I want to talk about is how your situation relates to COVID and the allocation of scarce resources. Help me explain, as you did in the essay that you published today at my website.
Michael, I have been, first of all, like many people, I got my 3 vaccines. After the first 2, I was tested and I did not produce antibodies. And when I got the booster, I got tested again, no antibodies, which basically means I did not respond to the vaccine. I've been just constantly following developments and hoping that something would come along for people like, well, let me explain this first. When you get a transplant, organ transplant, or you have certain kinds of cancers, you get treatment. In my case, I take a couple of pills that deliberately weaken my immune system. And that's so that my body will not reject this new organ, the heart. It's somebody else's heart in my body, and that's how that works. So I'm deliberately making my immune system weaker. And as a result, I'm more vulnerable to, or it's harder for me to fight off ailments. And that's not going to be a big deal if I catch a cold or that kind of a thing. But with COVID, I'm actually less protected in a way than an unvaccinated person, because in my case, not only am I'm similar to being unvaccinated, even though I am vaccinated, but my immune system is weaker. So if I do get COVID, it's harder for my body to fight it off. So I've been desperately waiting for an answer to that. And finally, AstraZeneca develops this drug that it's an injection of antibodies into your arm, just like a vaccine shot, and it gives you 6 months plus of protection. And the issue right now is that, well, this news came out in early December. I was thrilled. I call my doctors immediately and say, when can I get it? I'll come down to Baltimore, get the shots. And they tell me it's in very short supply. It may be months before you can get it. And in addition to that, we're also using some of the doses to treat unvaccinated people who've come in with COVID and are severely ill. We're experimenting, trying it on them. So the shot that I need, in some cases, is going to people who, by their own choice, wound up with COVID in the hospital with severe illness and are getting these shots. So it's a double whammy, the short supply and some of it being allocated to people who got sick because they weren't vaccinated.
What is the treatment to which you're referring?
It's antibodies. Basically, it's called.
What's it called?
It's called Evusheld.
Evusheld.
Yeah, SHELD, EVUSHELD. And you get a shot in each arm, and what it does is it gives me the same antibody protection that someone like you would generate on your own through the vaccine. I can't generate that response, so this mimics that. And in fact, it's maybe even a little better than a vaccine because it's been shown to last beyond 6 months. So it's tremendous protection for immunocompromised people.
And would it be fair to call Evusheld one of these monoclonal antibody treatments?
Yes, it's a variation of it. So the monoclonal antibody treatments that you see and you hear about typically are IVs. You get them through your veins, and they're given to people who get sick, but the effect of those lasts about a month. They are strictly to make people better who have contracted COVID. It's antibodies as well. What's different about this is you get it in advance so that you have the protection against COVID, but it is the same. It's basically the same stuff.
Kirk, you probably don't know this, but I have discussed your case without any idea that this is the situation you were facing in the abstract, because it was actually presented to me by a close friend and one-time intern many, many moons ago, Dr. Anthony Mazzarelli. And Maz, who is the CEO of the Cooper Medical Center, often discusses with me these medical ethical issues or medical legal issues. And he said to me, there's a very interesting issue on the horizon as to how we allocate scarce resources, similar to what we're going to face when the pill first comes out next month or soon thereafter. But he said to me, there aren't enough monoclonal antibodies to go around. And given a choice between two patients, how should a medical practitioner or a medical system treat someone who has made a conscious decision not to be vaccinated when there's another patient with an equal need who has done everything by the book, everything that we have asked of them? And here you are, a heart transplant patient who has been vaxxed, who has been boosted, who now requires a treatment to boost your antibodies because you didn't get it from the vaccination. And I understand it now, the way that you've presented it. Your system was intentionally depressed so that your heart wouldn't be rejected. Okay, now you've got the heart. Now you're functioning well. Now you need some level of protection against COVID. And you're not able to get it for, among other reasons, because unvaccinated people who are very ill are being treated on an experimental basis with the medication you require.
Michael, it's extremely frustrating. And I don't make judgments on those people. They've read material, they believe what they read. And I mentioned in the piece that you referenced that I had a coworker whose dad died of COVID. And he and his family vowed, it sounds a little strange, but in their dad's honor, none of them will get vaccinated. They have come to believe it does more harm than good. And the irony is, if my coworker or his mother contracts COVID and gets severely ill, which there's a good chance because they're unvaccinated, they could get one of these shots that I'm waiting for. And I'm not here to say whether that's fair or unfair. I can tell you that when I talk to the doctors at Hopkins, they're very sympathetic, and they say that we're going to have to have a lottery and draw names and see who gets lucky enough to get this shot. And there are more treatments coming down the line, but it's a frustrating situation.
How many, I mean, maybe people are listening to this or will watch it and they think, well, this is such an outlier. Your friend, Kirk Dorn. I mean, how many could there possibly be like him who are immune compromised? Do you know the answer to that question?
Yes. I mean, about 3% of Americans are in that category. So we're not the majority. There maybe are 7 or 8 million of us, but there are a bunch of us out there. And I'm constantly communicating with groups who are trying to advocate for this minority population, immune compromised people. But yeah, there are a few of us out here.
Hey, 7 million is a big number. So is a decision, I don't know if you probably do know, like, who holds the cards in making a decision, and is one decision made as to what the approach should be for the entire healthcare system in the country? Or does Johns Hopkins have one way of addressing this, and NYU might have a different approach, and Mayo Clinic might have a different approach? Do you know?
You said it exactly right. That is what, I mean, the CDC is not weighing in on this. So when I talk to the docs at Hopkins, the infectious disease folks, and they're very sympathetic, they're very good conversations, all they'll say to me is, you've got to keep acting like you're unvaccinated. And we don't know yet. We really, as I mentioned to you, they're going to draw names out of a hat. That's what they've decided to do. I don't know what other places are doing, but in the case of Hopkins, I can also tell you my family doctor is associated with Penn Medicine. So I also went that route, and all their Penn is saying is that this is in short supply. We're still determining how to allocate it.
And finally, Kirk, how then do you lead your life on a day-to-day basis? I would imagine yours is quite a sheltered existence, given that you just don't have much protection.
Well, I get outside, I feel I'm safe. So I am out every day. Any meetings I have, I try to do lunch meetings outside. I'm outside doing activities every day. But yeah, my daily life is here in my office at my house. And even the office that I work in, the office is completely vaccinated, but it's not even safe for me to go there because coworkers have children. Even though they're vaccinated, they could bring something into the office. So yeah, I mean, I don't want to say I'm living in an egg carton, but it is. I'm certain I really would appreciate my freedom, which this shot would give me, if it becomes available.
Do you have any level of conversation with Hopkins, any of your practitioners, where you say, hey, well, I don't even know how I would say it. I don't want to judge, et cetera, et cetera, et cetera, after you get through all the preamble. But then, like, how come the person who's made a conscious decision not to get vaccinated is being given something I need when I'm trying to check all the boxes and live by the rules?
Their job is to save people's lives. And I'm presented with a sick person versus one who needs protection. The choice is, let's save this person who's in bad shape. And I think that's basically what I get. And they reassure me we're developing treatments all the time and we're doing tests, and maybe a few months down the line we'll have something for you. So I can't, I'm just not a person who's going to make it. I can't criticize that. That's what they do. They save lives.
Okay.
So
well,
yeah.
maybe I can criticize it. You obviously cannot, but maybe I can. I mean, look, it's a hard issue. It's not a no-brainer because you're physically well, right? I mean, you're in this immune-compromised position, but you don't have COVID. You need a medication. Somebody else could be on their deathbed, I would say, through fault of their own. So who gets the med?
Yeah, well, let me. Of course, I agree with you, Michael. But I just don't want to criticize the guy dying in bed, right? In the hospital.
I get it.
But I
totally get it.
So I will say this. I want to make this point to you, and I was thinking about this because before I was going to talk to you, you're Jack Bogle, the former great from Vanguard, and I know a very good friend of yours. He had the same genetic heart disease that I had. He got a transplant at almost the exact age, and he went on for 23 years longer. And I just wish Jack Bogle were around today, because he would be advocating. He'd be getting something done about this, and we'd have this Evusheld out there, and people like him formerly and me would get the protection that we need.
Kirk, well explained. Complicated, but very well explained, and well explained in print on the website today and in the newsletter. Thank you so much. I wish you Godspeed and continued good health.
Thank you, Michael.